here in the United States, I mean, just like the Notre Dame student, that individual actually reported pretty mild symptoms. You know, I think, you know, there are other college students that have had this across the country, and they're reporting that, you know, they're not sure what the big deal is. That it wasn't that bad. So.
And the second question, you talked about people that should call their physician. Is everyone, like you mentioned, the Notre Dame student, I think, was given the Tamiflu or the antiviral? I mean, is that recommended for everyone, or at what level is this being recommended?
Yeah, it's a matter of severity. And actually, I'm going to find detail. I'm not actually sure if the student was actually treated with the Tamiflu at the beginning or not. So I don't want to speak on that. The treatment's going to be a decision based. The physician, the personal physician or the provider that's seeing the person will make that decision. Just like influenza, and we know that we've had folks have had cases of this that have been mild enough they haven't needed antivirals. So during regular seasonal flu, if you have mild symptoms, you really don't need the medication necessarily. But the isolation is important because we don't want you to give it to the next person who might be sicker. Individuals that have more severe symptoms, then certainly the antiviral is recommended. This is a little catch-22. We don't want to get resistance. So we don't want to overuse the antivirals. We want to use them appropriately, and that's the other piece. This is a balancing act, quite a balancing act that we are trying to conduct, and that's why the more experts and folks that are watching this, the more information we receive about this virus, we're going to be able to make better decisions.
At the local level, has the EOC been operational, and also are there protocols in place for 311, 911 for call takers?
We'll let Bernie Byer, the Pierce County Emergency Management Director, answer that question.
At this time, the Emergency Operations Center is on a limited operating basis where we're monitoring the situation. The focus of the effort right now locally is on public information, crisis information, what we know, getting it out to you, the public, in the right form, clear, concise, complete, and correct. Just before this meeting, at least a third of the people in the audience here just came from a public information meeting, where both public and private public information providers are making sure that we're together in what we say, that it's correct, and that we're supporting each other so we give that clear, concise message. So that's the focus of local effort right now, is on communication.
And we did open our hotline yesterday for the public to ask questions, general questions about this issue at 449-7506, so that's been open as well.
Question for Dr. Monroe. I guess, you know, everything aside, where do we go from here? I imagine that at some point people will start shaking each other's hands again and get back into.
That's going to be a hard habit to break.
Exactly. You know, at what point do we start to get back into some sort of normalcy?
Well, it will depend. I mean, we will. You know, one scenario might be that this virus in the next, actually in the next few weeks, 2 or 3 weeks, we might stop seeing cases. It's a matter of, are we seeing an increase in cases or are we seeing a decrease? And we're going to have to judge all that. We will be right on top of that and giving messages at that time regarding, where we are. One of the considerations is, will this virus right now, with summertime coming, will we see, the uptake and then begin to see a decrease? And because we follow seasonal influenza, we have a lot of information, a lot of intelligence around that. Every year, the CDC is mapping out, and they can tell you, we're starting to see a dip now in the seasonal influenza, and then, we're not seeing very many cases. That's the way this is, from a national perspective, will be watched. And then obviously at the state level as well, we'll be watching that. One consideration is this a virus that next winter will come back, and maybe come back in a more virulent or a more potent form. That's a concern right now, and there's a lot of discussion at the federal level about developing a vaccine. My understanding is if that is decided, a vaccine could be developed by September with the first doses, but then they'd have to continue production, and that's why this is so fluid. There are a lot of major public health decisions that are being made as we speak. But this ability for public health to test and monitor and follow all of that, I mean, epidemiology is really the backbone of public health. It's that monitoring of diseases, and this just drives home the importance of public health and how critical it is that we have strong public health and have the resources in public health to manage things.
But is it possible for someone to be contagious yet show no signs of symptoms and pass the disease from one person to another?
Yes, what we believe right now is that it's possible that, so you're incubating the virus, and a day or two before you develop symptoms, you might be contagious. And that's the part that's the hardest. And that's why the message is every day, keep your, social distancing, and the cough advice and the hand washing advice, all of that is for that reason. Because even though the person's perfectly well, if you have too close a contact. Now, it's a little harder when you're asymptomatic. I mean, but still, if that person is starting to shed virus and they just rub their nose and they shake your hand and now you rub your eye, boom, you've just passed a virus. That's how it happens. Yes?
I know there are travel recommendations for Mexico.
Yes.
Do you have current travel recommendations for states that have a larger number of cases, say California, Texas?
No, there haven't been any travel recommendations that I've seen. Again, this is so fluid. Things are coming in. Each time I give a talk or a press conference, I learn something afterwards. I've not seen any travel, and I think it's, again, it's that situational awareness. If individuals are planning a trip someplace and they know that there's a larger outbreak, they may want to personally make that a consideration about the travel plans. But there's no guidelines within the United States.
For clarification, I'm asking this so we don't confuse our viewers at home. The state is recommending that we call this one name, yet the CDC still has it as swine flu. Are you hearing from the CDC that they may be changing the name? Is this pressure from the pork industry? I understand.
Actually, the CDC is the one that just, like in the last 2 days, put out this official name. So this is coming from the CDC, the Influenza A H1N1 North America human. Now, I know that's a mouthful. I just today saw that for shorthand, they're calling it the swine origin human virus, I think is the way. So words are powerful. And so as soon as people hear swine, they start thinking, that our swine are infected, and that's not the case. We're worried about human health here, because that's who we're seeing this spread in. And so it's just a matter of making sure the public understands that's what we're concerned about. They can eat their pork. Just make sure you're cooking it at the proper temperature, which has always been a message. Probably not too much of it. Yeah, not too much of it. There we go.
Thank you. I have a question for Mr. Wayne Scott, and I wouldn't be doing my job if I didn't ask this. I hate to ask this question, but is there any thought that a possible bioterror, terrorism might be at play here? Has that been ruled out? Any thoughts on that?
Well, obviously, that's always something that the investigators look at, and our intelligence community is looking at. At this point, I've heard no indication, and we've been on a conference call every day with the U.S. Department of Homeland Security for Homeland Security advisors, but no indication of that. In fact, I think there has been some evidence that they may have found ground zero of the flu outbreak in Mexico. So those are all part of the investigation. That's a fair question that we ask, but at this point, there's no indication.
Epidemiological work of this, if people are just to call their doctor, and how are you tracking if you're not doing measles, mumps,
The CDC feels like we will get enough testing with those that are symptomatic enough that they actually need care, need to see the ones that have a little more serious illness and need the antivirals, or maybe need to see their physician. Also, if the physicians may ask, even someone with mild disease, we're asking them to stay home, but we've given the physicians guidance. So the physicians, if they're pretty suspect, they may invite the patient to come in and go ahead and do a swab anyway. So we're going to be getting a lot.
And that is sent down to the state.
Correct.
All those folks,
Correct. And the state, I believe this week, the state will be receiving the kits and have the ability here at the state to test specifically for this virus. And right now, we have to send them to CDC for confirmation.
If it got enough cases, I remember back with West Nile virus, where it was finding that we can't keep sending everything to the state.
Correct.
Is that conceivable?
Yes.
Are you looking at it that
Yes,
where the testing could be done locally?
That's a great question. There's actually a point, if this is widespread enough, if this were to become a pandemic, then there's a point where you don't even need any testing because it's out there and we know we'd overwhelm the system. But it's so critical to do the testing now in all the areas because we're studying it and understanding it. So.
I want to thank you all for taking a lot of your time today. I think we owe those that have come quite a ways to inform us and keep us up to date on the current situation in our state, particularly on the round of applause. Thank you all very much. Thank you all again.